Herzlich willkommen auf www.fair-aid-ev.de. Ich bin Jörg Mauch und ich freue mich, dass ich heute mit Esther Sungu in Kenia sprechen kann. Esther Sungu ist unsere Projektmanagerin seit 2012 und sie wird mit uns über die Situation in Kenia sprechen und natürlich auch im Speziellen die Situation bei Choice for Life. Hello, Esther, and welcome to this meeting. It's nice.
Thank you.
How are you? My first question.
I'm fine, York. I'm fine, and the family is fine. We are restricted to quarantine ourselves in the house, and we are keeping safe. Yeah, but we are fine.
Okay. Es geht ihr und ihrer Familie gut, aber sie sind auch in Quarantäne bzw. sind angehalten, zu Hause zu bleiben. Und, aber ansonsten geht es ihnen gut.
Yeah.
What is the corona situation actually in Kenya?
In Kenya, the corona situation began slowly, but it started going gradually high. So far, right now, we have over 2,200 plus people affected. We also have above 70 who have died. We have recoveries of above 500, but the numbers are increasing every day and every day. The two major cities that have been affected mainly is Nairobi and Mombasa, and mainly the urban sectors have been affected.
Also es hat relativ klein angefangen, aber mittlerweile steigen auch die Zahlen in Kenia und vor allem die Städte sind betroffen. Nairobi, Mombasa und andere Städte sind vor allem betroffen. The fear is that many people who work in the cities to earn money, that they come back to their villages and travel back to their villages and spread the virus. Is there any rules for them?
Yeah, there are many restrictions and rules that have been put. First of all, in Mombasa and Nairobi, you cannot go in and out. There is a lockdown in Nairobi, there is a lockdown in Mombasa, and therefore there is no movement for businesses and all that. Those people most of people in Kenya, they do business. They went to town because of business. So they go out and in of the Mombasa. Mombasa is also a port where most things that are transported in Kenya through the water through system and the airport, we receive our goods, the exports and the imports. So because of the lockdown in Mombasa, that has an adverse effect in the economy. But there is that fear that if it spreads to other towns, then there is a high risk that if people move in the rural areas, they can be a problem. But for now, we are not, those of us who are in urban areas, we are restricted not to go to the rural areas. Ja.
Also es gibt einen Lockdown in den großen Städten. Man kommt nicht rein und man kommt auch nicht raus. Aber gerade das ist auch ein großes Problem, weil zum Beispiel über Nairobi, über den großen Flughafen, viele Waren nach Kenia kommen oder über Mombasa, den großen Hafen. Und das ist eine große Belastung für die Wirtschaft. Aber es gibt tatsächlich die Befürchtung, dass die Menschen nach Hause gehen wollen in ihre Dörfer und dadurch das Virus auch weiter verbreiten. Und deswegen sind die Regeln sehr streng.
Yeah, and again, there are restrictions of social distancing. Therefore, there are no gatherings. People, they don't go to church. You don't go to crowds in markets because our markets are open. Our markets in Kenya, they have crowds of people. So they have restricted selling in crowds. Those who used to sell second-hand clothes, all those markets have been closed down. Those who sell foodstuffs in a closed market, they have also closed down that. So there is a problem of the economy because of the social distancing, no gathering, no many activities that would attract a crowd. People are mainly encouraged to stay in the house. So there is a social problem and economic problem.
Also es gibt auch Social Distancing in Kenia und die Menschen können eigentlich nicht mehr ihrer Arbeit nachgehen und dürfen sich nicht in großen Menschenmengen aufhalten. Viele Kenianer leben von kleinen Jobs, die sie jetzt auch nicht ausführen können. Und so ist es auch ein soziales und ein wirtschaftliches Problem. That means when the people can work to earn money in the moment, how they get their daily food?
Most people are depending on their family members, those who can afford, and even neighbors and relatives, and maybe church social gatherings who can contribute some small money, and then they give those who are affected. Different groups come together and contribute food. Mainly the major problem is how to put food on the table. They don't care about many things like clothes. So people like, if people are living in an urban area, for example, they are being supported by the neighbors, by their brothers and sisters. That is how they are surviving. In the rural areas, they are doing the same. The government came up with a policy to support the vulnerable, but they are only supporting in slum areas in Nairobi and Mombasa, because Nairobi and Mombasa are the ones reporting higher numbers. But these other cities and rural areas are not supported by the government, only in 2 cities.
Okay. Also die Menschen unterstützen sich gegenseitig in den Familien, aber auch in der Kirche oder in anderen Einrichtungen und unterstützen sich gegenseitig. Und die größte Sorge ist tatsächlich, wie man das tägliche Essen auf den Tisch bekommt. Von der Regierung gibt es Unterstützung in den großen Slums, in Mombasa und Nairobi, aber eigentlich nicht auf dem Land. Und so ist die Unterstützung der Regierung doch sehr gering für die Menschen.
And in town, people are really affected. For example, a friend of mine called me. She stays in town with she's a single woman with 4 children. So she was calling me and telling me that today my children cannot wake up because they slept hungry. And she does event business, you know, these events of tents and chairs. So the business was affected because there is no gathering, there is no putting of the tents. So she told me that her children are unable to wake up in the morning because they are very weak, because the previous day they did not eat anything. So you can imagine what it means to the entire world of Kenya.
Also er berichtet von einer Frau aus Nairobi mit 4 Kindern, die Hunger leiden und auch, dass die Kinder nicht mehr genug zu essen haben. Die Frau ist eigentlich im Windmanagement beschäftigt gewesen. Das findet momentan gar nicht statt und so gibt es auch kein Geld und kein Essen auf dem Tisch für die Kinder. And now we have the second crisis of locusts in Kenya. And what do you think? Will be this also?
The locust problem, which was also a big problem in Kenya, the locusts, because they affected the crop production in the areas where they were affected. It was not the entire country though, but because of those people who had planted the crops and they ate the maize, everything. That is bringing food shortage. And the government says there is likelihood of the food crisis unless they do import, but there is now food crisis. So when you mix it with Corona problem, because now Kenya depends in Uganda for imports, for food imports, mainly beans, most of the food we eat in large numbers, we get it from Uganda because it has a high production of the same. So the foodstuffs have gone up because there is food shortage in Kenya. So it is a problem of hunger, the economy and hunger, I mean, there is no, because most people don't have also jobs because of Corona, and then the food shortage because of the locust. So it's double problem.
Locust, das sind die Heuschrecken und die Teile von Kenia befallen haben und von Ostafrika befallen haben und viele Lebensmittelfelder, also Kornfelder, Maisfelder abfressen und somit viele Lebensmittel für die Menschen vernichten. Deshalb ist Kenia auf den Import von Lebensmitteln angewiesen und gemixt mit Corona bedeutet das, dass der Import momentan über Hafen, Flughäfen und über Uganda und so momentan auch nicht funktioniert, sodass die Lebensmittel sehr teuer werden und man tatsächlich eine Lebensmittelkrise befürchten muss. What do you think when the health system in Kenya, when the virus will spread, can the health system manage the situation? Maybe in Kakamega? Esther? Esther? Esther, can you hear me?
No.
No.
The health system is still very low, and for maternal health. But the people who have been affected mainly have been in Nairobi, and the hospital being used in Nairobi, in Kenyatta Hospital and Bakati. But the other around 42 counties don't have referral hospitals where they have ICU ventilators. They don't have those adequate health facilities. So the health system in Kenya, especially in the rural areas, in the underdeveloped cities like Kakamega, it is very bad. So if this virus, that is why when they get somebody who has a virus in Kakamega, they rush the person to Nairobi. They don't leave the person in Kakamega. So that if in case they continue and it goes to Kakamega or other places like Vihiga, these small counties, then there will be a big problem of managing. It can be very bad.
Also eigentlich werden momentan alle Menschen mit Corona in Nairobi behandelt, weil in den anderen 40 Counties auf Kenia es kaum Möglichkeiten gibt, genügend also Menschen wirklich zu behandeln und deswegen wird es auch ein großes Problem, wenn die Zahlen steigen werden. Now let's talk about choice for life. Esther, you can hear me? Hi. Okay, let's talk about choice for life. What is the situation of choice for life in the moment?
Sorry, there must be a network problem.
Let's talk about choice for life. What is the situation of choice for life?
Yeah, choice for life in Kenya, it has been affected because of our children. From the onset of the problem of Corona, all institutions were closed down, and including the schools. and most of our children were in boarding high school and day schools. And so all of them are at home with the guardians. And because also the guardians are a vulnerable group, they are also affected because they cannot go sell their goods, they cannot go for their table banking gatherings. So they have a food problem. And the children are at home. They are being supported by the social workers visiting them, Choice for Life, by support of Fair Aid. They are given some small food, but we cannot manage all the need of the food. So they are just at home, and it's a big challenge for the guardians right now, I can say.
Mhm. Also die Schulkinder, die sonst eigentlich ja, zur Schule gegangen sind, zur Ganztagsschule, die dort Mittag gegessen haben, einige auch in Boarding Schools, also in Internaten. Alle Kinder sind jetzt zu Hause. Die Guardians sind oft auch selbst Risikogruppe und auch zu Hause bei den Pflegefamilien gibt es auch ein Nahrungsmittelproblem. Und so ist die Situation für die Kinder, die von Choice for Life betreut werden, momentan sehr schlecht. Die Sozialarbeiter besuchen die Familien, unterstützen sie auch mit Essen, aber das kann nicht genug sein. Also es ist nicht genug da zum Verteilen. Yeah.
Yeah, and again, in Kenya, we don't talk about sexual violence, but most of the families in the rural area, including our guardians and our children, are exposed. They are exposed to problems like sexual violence because, you know, like the houses of 2 by 2 meters, a very small house with the 4 children or big girls and their guardians, it is a risk to those children because when they are now staying there, they are not going to school every day. They are there. It is there has been cases reported on the TV what the families are going through in Kenya. Most families have reported a large number of sexual violence, although in our African society we don't talk about sexual issues in open. So most of them suffer in silence. They just suffer in silence. They cannot report. Although for our children, we have not had a case that has been reported, but it's just that they are exposed to this kind of problem.
Mhm. Also ein Problem ist auch, dass wenn die Familien sehr eng aufeinander leben in kleinen Häusern, dass es auch zu sexuellen Übergriffen und zu gewalttätigen Übergriffen kommt. Das ist noch ein Tabu in der kenianischen, afrikanischen Gesellschaft. Aber die Befürchtung ist, dass diese Fälle auch steigen in der Corona-Krise. Noch weiß Esther von unseren Kindern von Choice for Life nicht, dass sie da betroffen sind, aber die Befürchtung ist da, dass es dazu kommen könnte. Und es ist sicherer oder besser für die Kinder, wenn die auch regelmäßig in die Schule gehen können. Ja. There are no meetings in the moment at Choice for Life. No table banking, no...
Yeah, because one of our major program includes table banking, and we gather in groups every 2 weeks, or sometimes others meet monthly. And we also go to empower them, to support them. So we are restricted to move and meet such groups. They can't meet because they don't have even what to take because their economic empowerment sector has been affected. So they cannot come for gatherings because of the government restrictions. And because of that, it has really affected the table banking. The circle has been affected also.
Also nicht nur die Schule ist betroffen, auch das zweite große Projektgebiet von Choice for Life ist betroffen, das Table Banking in Sachsen. Dennis sind keine Treffen möglich. Die leben ja von gemeinsamen Treffen. Aber auch, wie gesagt, selber Geld zu verdienen und Small Businesses und so sind momentan nur ganz schwierig zu gestalten und sind eigentlich eben auf dem Markt oder so kann man nicht gehen und solche Dinge. Sodass auch hier momentan keine Treffen möglich sind. So what do you think? How can help Choice for Life and for Aid? How can help now in this situation? How can we help the people of Choice for Life? What is the most?
Yeah, right now the major problem is food. We did not pay the school fees, but the money, the small money we normally give for feeding program, we used it to give the guardians, and we've been, giving them what we can afford. But the need is more, and the problem of food is urgent, and if they can be helped to survive this corona situation. Most of them are told to buy masks, but of course they have some masks, but they cannot get new ones every day. So they improvise ways of just tailoring those who have, which they can use and wash again and reuse, because they cannot buy masks every day. So they can use it if they can go to the market or anywhere, they can use it. But because most of them are vulnerable, they don't have activities they are doing. I think for now, they just need food as an urgent mitigation. And then we hope that the government will talk something about education tomorrow so that they can go back, the children can go back to school.
Also einmal Lebensmittelhilfe ist ganz wichtig, dann aber auch Aufklärung über Hygienemaßnahmen und Masken werden benötigt. Und dann ist die große Hoffnung, dass die Kinder wieder bald zur Schule gehen können. Okay, Esther, what is your hope for the future?
Yeah, we've been supporting the children with the exams to revise. So we hope that when they go to school, they'll catch up with their education. We are also hoping that the groups, when we start again, we'll visit them. I know in Kakamega, maybe it is not adversely affected. So we are praying that the people who are in the city will not go to the rural areas to spread this virus. So we hope that the rural area will remain safe, so that when we begin again, we will be able to train them again and redirect them back to the activities which will support them again. The youth program was affected because we cannot kick off when the situation is like this. And we also hope that when they start the gatherings, I will go there again myself and we begin again some programs with them. Yeah.
Also erst hofft, dass es bald weitergehen kann, dass die Kinder bald wieder zur Schule gehen können und dass sie auch die Bildungslücke auch schließen können und dass Choice for Life bald wieder seine Arbeit aufnehmen kann.
Yeah. Also, the government, they announced that there is coming to be a vaccine, which they have not, which they are still working on, but it seems if there is a group called Gavi, and they want to vaccinate like all the children. So we hope the vaccine will not have bad effects on our children. So it's still in discussion. So when they vaccinate all the children, maybe they'll be safe at school. So we are hoping for the best, because coronavirus is not something that can end today or tomorrow. We have to learn how to live with it. So if the children are vaccinated, maybe the elderly, we can wear masks and keep social distancing and be responsible. But the children are our children are the most who are at a high risk and the old people. And you know, Choice for Life deals with children and old people. So it is directly affecting us. But we have hopes for the best.
Yes, me too.
Yeah, we are keeping an eye on the government to talk tomorrow. The president is going to give a ruling. They've been working on guidelines that can help when the schools open, churches open, the guidelines that can help the economy to open up again. So we hope those guidelines in an African setup will work. Ja.
Also, die Esther weiß, Corona ist nichts, was morgen vorbei ist, auch nicht übermorgen, sondern man wird lernen müssen, damit zu leben und verbunden mit einer Hoffnung auf einen Impfstoff und dass die Regierung auch jetzt bald auch weiter bekannt gibt, wie es weitergeht und dass dann da auch eine Öffnung möglich ist. Okay. Thank you very much, Esther.
Thank you.
Is there something what I forget to ask you? Maybe you have some.
I think we have talked most of the things, and mainly our transport system also is affected in the country because of the truck drivers having been affected with corona. The truck drivers are the ones who are affected mostly because they brought it from other countries. So the transport system has been affected so much. So that brings food shortage, which is the same problem we have talked about. The lockdown of the Tanzania, Uganda, and Somali also bringing export and import problem. So the flights, they cannot come in Kenya, they cannot go out, and Kenya is a country which also exports things. So the economy in general, the economy of Kenya is highly affected and it's really at risk. That's why we are praying that tomorrow the government can also open up. And also an African country, mostly Kenya depends, most NGOs that are in Kenya depends on the donor world. And you know, the donor world has also been affected. So most NGOs have also been, I know of an NGO which has laid off the workers. And I thank God for Choice for Life because we were not laid off. But most NGOs have laid off workers because maybe they were in one way infected by the coronavirus or affected. So the donors cannot contribute to the organizations that support programs in Kenya. So that is also another problem. Yeah.
Also die Wirtschaft in Kenia hat große Probleme, das Transportsystem, der Warenverkehr und vieles mehr. Aber was wir noch gar nicht so angesprochen haben, was Esther nochmal gesagt hat, dass auch viele Hilfsorganisationen momentan Mitarbeiter entlassen und auch fürchten, dass das Spendenaufkommen zurückgeht und viele afrikanische Länder sind auch von der Spendenbereitschaft anderer Menschen abhängig. Und sie dankt für Aid, dass wir momentan noch nicht betroffen sind von Geldmangel. Und aber auch das ist eine große Gefahr für die Menschen. Okay. Yeah. Then we are the best. And, I think we can need every euro to help the people of Choice for Life.
Thank you.
And we hope many people will again and give money, donate money for Choice for Life. Thank you very much, Esther.
Thank you,
I wish you all the best. God bless you and your families. Say greetings to the team. and goodbye.
Yeah. Goodbye.